Hello, I'm Dr. Michael Wright. I'm the Chief Medical Officer at Avant. Today I'm joined by Ruanne Brell, our Senior Legal Advisor. Hi, Ruanne.
Hi, Michael. Thanks for having me.
Thanks for joining us. At Avant, we know that Medicare and the rules and requirements to comply with it can be complex. And in this series, we look at some of the top questions our members ask about Medicare and what you need to know. In this episode, we're going to talk about one of the issues which arises when you're billing more than one MBS item associated with a single patient interaction.
So, Michael, I've spent some time at Avant on our medico legal advisory service, and we know that members have lots of questions about Medicare. One of their issues is how they deal with Medicare billing when more than one service is provided on a single occasion. This might come up where a patient undergoes a procedure and a consultation also takes place, or where the complete item descriptor might be part of the broader item descriptor for a larger item. How do you deal with this?
Thanks, Ruanne. Subject to any specific requirements, you can bill more than one MBS item number to a patient on the same day. But it's as long as each item is clinically relevant and necessary for the appropriate treatment of the patient, and that you have met all the necessary requirements of each service. And that as long as both of those are met, you can bill multiple items. So, Ruanne, having said that, there are many specific restrictions which apply to particular items and particular categories in the MBS, including where one service is rendered in association with another item, and the item descriptor includes a phrase such as cannot be rendered with another item. And so it's important that practitioners look at MBS online to work out what these restrictions are. So you should familiarise yourself with the item and the full item descriptor and any explanatory notes before you bill the item. One example in general practice is we have chronic disease item numbers, and these are typically longer and more comprehensive item numbers. These cannot be billed on the same day as a standard consultation item number, and that's a specific restriction within the MBS.
Thanks, Michael. That's a really good example. And what about in general? Are there principles which provide the framework for understanding what can and can't be billed?
Yeah, absolutely. So the principle underpinning all of this is the complete medical service principle. So it means that each medical service must fully meet all the elements of the MBS item on its own. For example, if major surgery involves several procedures which could otherwise be billed individually, but which all form part of major surgery, then only the item number for the major surgery can be billed. Conversely, though, if each necessary procedure can stand on its own and each descriptor is fully met, then each item can be billed.
And so changing tack now, but talking a little bit more about procedures, what about billing a consultation with a procedure? Say the doctor takes a history or does an examination to confirm a patient is fit for a procedure, then explains the procedure and consents the patient. But can you do and bill for the procedure on that same day?
This will depend on the procedure and the requirements of the relevant item number being claimed. So generally, we'd say it's best not to recommend a procedure and consent a patient for the procedure on the same day, but sometimes it can be unavoidable. Once again, a practical term might be if a patient presents for a consultation and in the process of that consultation, a procedure needs to be fulfilled, then you could bill both of those. But if a patient attended just for the procedure, then it would, in most occasions, be inappropriate to bill for the procedure and a consultation item number.
So are there some common situations where this arises?
One situation would be, say, if a patient presented for a consultation, they had a skin check, and then you decided that they needed to have a skin cancer removed, then that procedure and the consultation would be appropriately done if the clinical documentation was adequate. Whereas if a patient had already been seen and was just booked in for the procedure, then it would be appropriate just to do the procedure. I suppose in both of the situations, documentation is important, and particularly where a doctor said they did a consultation and a procedure, if the documentation of the clinical consultation is inadequate, then they're more likely to get into trouble. And there may be a view that it's really just a component of the procedure.
That's a good point, Michael, because as lawyers, we always might like to make sure that everyone's aware of the importance of documentation.
Yeah.
So adding to that then, when we're talking about billing more than one service on one day or at one time, what if you bulk bill one service? Does that mean you have to bulk bill all other services provided to the patient on that day, or can you bulk bill and privately bill?
you can bulk bill and privately bill. As long as you have met the clinical criteria for the multiple items, you could bulk bill a patient for the excision of the skin cancer, but privately bill them for a consultation for a skin check earlier. So that is appropriate use of Medicare. But once again, it's about clinical documentation and ensuring that you've met all the criteria that you need to do for the multiple item numbers.
Thanks so much, Michael. That really helps understand this complex area. And thanks all for joining us. Remember to look out for the other episodes in our series explaining the ins and outs of Medicare billing and compliance.
Thanks, everyone.